Welcome to Stallside Podcast.
Dr. Templeton, welcome to Stallside.
Oh, thank you. Thank you so much for having
welcome.
me.
Thanks for coming and joining us today.
Yeah.
Appreciate it.
So, Sarah, tell us a little bit about yourself.
Well, I am originally from Knoxville, Tennessee. I was born and raised there. I did my vet school at the University of Tennessee, and then I came here for the internship and stayed for the residency program.
Okay, what got you into veterinary medicine?
Well, I've always loved horses. They've always been really important to me ever since I was little, but I didn't want to be a veterinarian when I was young. I originally wanted actually to be an actress, so I was really heavily into theater when I was a youngster. And then kind of had a quarter-life crisis when I got to college and started studying journalism.
Quarter-life crisis. Good.
Yep. It hit pretty bad. I realized I didn't really love advertising in my journalism classes as much as I thought I would. So anyway, I decided that, maybe I wanted to go and do animal science instead. I've always loved horses. I thought, hey, I could shovel horse poop for the rest of my life and be happy. So I did, and I loved my animal science degree. Started working for a veterinary hospital, as you do when you're an animal science student in undergrad. And saw my first surgery. I think it was something like a spay and a dog, and just thought it was the coolest thing ever. Then I decided I wanted to go to vet school, and I've been pursuing it ever since.
Gotcha. Well, you can still use those acting skills. I act every day. I just saw a case. I'm not kidding. An hour ago, and I pretended I knew what I was talking about, and I had no idea.
That's me every day.
Yeah. Words from the master. Well, this explains why there's so much drama that always surrounds you.
Oh, always. I live for the drama.
You're still doing the acting now, because you can do that. I mean, you don't have to be a full-time actress.
Not right now. A little bit busy right now, but I hope to one day be able to get back into it. I'd love to do community theater as a hobby one day.
Great.
Excellent. So you came here for the internship. Mm-hmm. Tell us about what you're up to now here at Rood and Riddle.
Well, I am just finishing up my second year in the surgery residency program. So that is a 3-year program where afterwards you can be board certified in surgery. And so I've been doing that for the past 2 years, ever since I finished my internship, and I'll be starting my 3rd year next month.
Excellent.
All right.
So we know why you became a veterinarian, because you liked horses. Why did you pick surgery of all of the things? Like a number of people we've talked to, everybody has their little thing they're interested in. Why did you decide to be a surgeon?
I thought it was, first of all, really cool. And then I thought, maybe I've got the skill sets to do this. I really like things to be orderly and tidy, and I like to have my little space, and I like to be able to essentially put things back together or kind of figure out a puzzle on the fly, if that makes sense. It's very gratifying. It's nice to be able to help these horses that are in kind of imminent pain all of a sudden feel better. It's one of my favorite things about surgery. I just really enjoy it. I have never had a dull moment. Everything about it still excites me, so I have a lot of fun with it.
And within surgery and the horse, what's your particular area you're interested in? Like, you can do orthopedic surgery, you can do soft tissue surgery. What do you think that your path is going to be? While
I love all aspects of surgery, I have been drawn more towards the emergency aspect. So things like lacerations, dystocias and C-sections, but I think probably colics are one of my favorite things.
Okay, so tell us about colic, because for the people listening out there, they'll probably consider colic as one all-embracing term that explains everything, but as you know, it's really complicated. So just talk a little bit about colic, talk a bit about the subdivisions, and which particular one that you are more interested in than any other.
Yeah, absolutely. So colic is basically a very broad term that is essentially covering all abdominal pain in a horse. So you can have pain from the abdomen that is not necessarily referred to the GI system that is causing colic. So you can break it down into your structure. So your GI system, you can break it down into your reproductive system, because some of those things can cause colic as well. And as far as the GI system goes, you can divide it more into things like gastric, which is stomach. You can divide it into small intestinal versus large intestinal, kind of depending where your problem is. And then you can further break it down into things that can be resolved medically, things that require surgery to resolve. And you can further break it down depending, of course, on what kind of colic it is and how you diagnose it and how you treat it.
So what's your favorite part of the horse's gastrointestinal tract?
Seriously?
Seriously?
Yeah.
Well, I mean, she's a...
Do you have a favorite?
Do you have a favorite part?
I like all of their gastrointestinal systems.
See,
all intricate
it's like
and wonderful.
You can't have a favorite, Peter.
Well, you know, I mean, wait a second, there's lots in there. There must be one part that excites you more than others. So
I'm just kidding. That was a fair question.
yeah, that was a fair question. But I mean, yeah, seriously. So if you had a choice, if you opened this horse's abdomen, the horse was colicking, what are you going in there buzzed hoping to find?
Well, especially around here, one of our most popular ways that horses like to colic is a large colon volvulus. And those are extremely gratifying to do, so I'd have to say that those are my favorite.
Okay, so volvulus, big word, not a car from Sweden.
Nope.
Tell us what volvulus is.
Volvulus is essentially a torsion of the large colon. So the colon flips around itself, or the mesentery, which kind of holds it to the body wall. And it can cause it to strangulate, which means it's cutting off its blood supply. So essentially you have a colon that is flipping around itself and has no vascular supply anymore. It's essentially necrosing there.
Okay, so downstream, what's going to happen? The colon has moved from a place that it shouldn't. What's going to happen to that colon? You mentioned the blood supply is compromised. What does that lead to?
Generally, it leads to a lot of cell death. So your colon, particularly if this disease has been going on for a significant amount of time, can die within the abdomen.
I was a little bit worried you referred to my colon right there.
No, unless yours is Taurus.
I just got a little bit of a pain here. Put me on the table and cut me. I'm a little bit worried. Yeah, but back on track here. So, yeah, I mean, that sounds pretty serious stuff. So what's going to cause the colon to get into the wrong place?
That's an excellent question. There are a lot of things that have been identified as risk factors. We don't know exactly what causes the colon to all of a sudden decide to rotate out of place. We do know that certain groups of horses are more at risk, which again is why we see it most commonly here, because our broodmare population is so big. Mares that have had foals are one of our biggest groups that are at risk of having this disease. And then there are other factors that have been associated with it, things like feeding and certain dietary factors can contribute to gas buildup within the colon, which could potentially cause it to TORS as well. And we know that horses fed a certain type of diet have different kind of bacteria that live in their colon. It's normal for bacteria to be in the colon. It helps the horse to digest the food, and it breaks down their feed into energy. So the horses need bacteria, but what happens sometimes is that population gets disrupted. So there are overgrowths of other certain kinds of bacteria that are not as healthy for the horse's colon. They can build up and more gaseous material, and sometimes that can lead to potentially a displacement or potentially a twist. There are other certain things too, like alterations in motility, so how well the colon is moving, and a few other things too have kind of been implied as a risk factor to developing these.
So talk about, if you don't mind, go back to the broodmares for just a minute, and let's hit on that, and just because I don't think if you've never seen a horse's abdomen opened up, it is a maze in there, and now you've taken this 150-pound mass that was in there, plus all the fluid that surrounds it. Take that out of there, and there's this huge void in there. So. Plus, you talked about motility too, right? And that's affected. So let's talk about the broodmares just a little bit and why they're more at risk.
Yeah. So a lot of people believe that the just sheer volume of the abdomen, particularly when you take away the space that the foal was occupying, can predispose them to just having more room in the abdomen for that colon to move around. So that is potentially why some of our broodmares are going to be the more likely at-risk group.
Yeah.
It never ceases to amaze me when, like the foal comes out and you look at it, and then I play this little game myself. I try to fold it up and put it back in the abdomen.
It's unreal.
Where was everything else?
I know.
And so where was this colon? Because you crack open another horse's abdomen and it's just all colon.
Yeah.
So you're right. So I've done the same thing. Put that fold. They're standing next to you and go, I can't believe you were in there yesterday.
Yeah. It's pretty. I think they come out like a puffer fish and go poof.
And
actually expand. But so that is a major problem, because these broodmares come in and they're violently painful.
Yes.
Right.
Well,
yes.
And the other thing is that those organs take a beating during foaling. I don't know if people recognize that or not, but
yeah, I mean, even during pregnancy too. Sometimes when we have to take a mare to C-section, that colon will be pushed way, way cranial in the abdomen, kind of where it's not supposed to be at all. And we kind of joke around that that's a displacement of pregnancy, but it almost seems to be kind of an incidental thing, an incidental finding that we can find in these pregnant mares, is the colon is just not in the right place.
Yeah. And I mentioned that these horses are like violently painful, right?
Yes.
So say my mare's had a colon torsion, not my colon, but her colon. What's the timeline? What am I going to see in that horse? What are the potential other things that cause that horse to be that painful? And what do I do?
Well, the very first thing you should do is call your vet or get the vet to the hospital, because time is of the essence in this with this disease. These mares or horse, it doesn't necessarily have to be a mare. We can see it in any age group, but these are very acutely painful. So they will all of a sudden be violently painful, throwing themselves on the ground, sweating, rolling, being very dramatic about their circumstances, and for good reason. They are in a lot of pain. Because these are in our broodmare population, another thing that we think of when we see a mare that has just given birth to a foal that is severely painful, the other thing that we think about is postpartum hemorrhage or bleeding after foaling. They can also be extremely violently painful when there is, say, blood accumulating in part of their reproductive tract or within the abdomen. So that's one of the things that we often have to differentiate when these mares come into the hospital. Is it potentially a hemorrhage? Is it potentially a large colon volvulus? Or is it some other type of colic? Sometimes mares during the process of foaling can do terrible things to their intestinal tract, like make holes in their mesentery, which are, again, the attachments of the intestine to the body wall, which then other parts of the intestine can get trapped in between. That can cause some pretty severe colic. So there are definitely different kinds of colic that mares can have, not just a large colon volvulus. But one of the hallmarks of the disease is it being so severely painful.
So this horse comes in to see you, right? And it's a dramatic presentation. Besides the pain that the horse is going through, what other things in your exam let you know that this is more serious as opposed to less serious? Right.
They are often grossly distended, so you can just take a look at them and they look nice and puffy. That kind of gives us a clue as to what it is. Then there are also other parts of our exam that kind of give us more of an indication that it's going to be more likely a colon twist. Our ultrasound has been extremely helpful in diagnosing this, or at least telling us that this is what the most likely disease is. If we see a large colon wall thickness of a certain size, we know with pretty good certainty that it's either volvulus or a displacement. There are some other things that we can see on ultrasound, which can tell us if it's likely displaced or if it's likely coming from a different part of the abdomen. The pain is coming from a different part of the abdomen. And also the ultrasound is very useful in helping us differentiate between a horse that is bleeding, because we can often see what we suspect is blood in the abdomen versus something where we have a very thick looking colon, and we can more likely differentiate that this is going to be a large colon volvulus.
And those are very important differentiations because treatment is so different.
Yes, very, very different. A large colon volvulus requires immediate surgery, and for our bleed mares, we have just to monitor them and really give them supportive care.
So you've made the decision to take this horse to surgery.
Yes.
You've opened the abdomen. you're visualizing this colon. What's your thought process there as to what the prognosis of that horse is going to be once you open that abdomen and look in that gut?
Well, unfortunately, it's very subjective, but there are some things that we look at to tell us, okay, this horse is probably not going to do as well as others. A lot of that is things like color of the colon. Obviously, a big purpley to black color is not going to be as good as your pink, healthy intestine. Things like increased edema is kind of gives us an indication that it's going to be more of a severe disease process. There have been other methods that kind of experimentally give you things like measuring interluminal pressure and taking biopsies of certain sites, but they're not necessarily really reliable or practical for giving you kind of a prognosis. So it's very often up to the discretion of the surgeon, and our surgeons here have seen so many of these cases that they have a pretty good indication of which horses are going to do well, which ones probably are not, or going to have more of a rough time in the postoperative phase. But horses can surprise you. We certainly have had horses with absolutely terrible looking colons in surgery, and we're sitting there thinking, oh man, she's going to get diarrhea. She is not going to do very well postoperatively, and they never miss a beat after surgery. And then we've also had horses that have had great looking intestines that we think are going to do well that develop all kinds of postoperative complications.
Yeah. You talked about some objective measures looking at the colon, but before the horse even goes to surgery, you're going to do some blood work and your physical exam. What things stand out in your physical exam and your blood work, your eyes and your ears, and getting some numbers from the lab that put the horse in a better or a worse position?
Things like heart rate. So if they have a high heart rated admission, that generally tends to be a worse prognosis, and things like high PCV, which is their packed cell volume, or kind of a measurement of dehydration. We do know that if that is a certain value, they don't do as well postoperatively.
Yeah, and lactate's a good measure as well, as a measure of perfusion. So after surgery, you've put this horse back together, you're going to give her a go. What are you looking for? What's sort of the time course on that horse? You mentioned diarrhea. What other things can happen in the post-operative period that are negatives, and what do you look for as positive indicators for that horse post-surgery?
We do a lot of careful monitoring with these guys after surgery. We know that if they have a high heart rate in 48 hours after surgery, they tend to have a decreased prognosis. We like them to be much brighter. We like them to be interested in eating, and we like all of their normal parameters to stay normal. We'd like them to have more normal PCVs or packed cell volumes to know that they're more hydrated. So there are a lot of different things that tell us that they're doing okay. Sometimes these horses get different complications. Probably the most severe is going to be diarrhea. They can kind of get endotoxic, which is a little bit of a different beast. But essentially, when you have damage to your colon wall, all of those bacteria that are contained within the colon can leak out of the vessels and the wall. And when those bacteria die, they can release a toxin, which causes just systemic inflammation and all kinds of terrible things in the horse, and then they just spiral. So we kind of are watching all of our parameters. We're doing multiple things with the horse. We're taking a temperature, pulse, respiratory rate. We're feeling their pulses, listening to their abdomen, evaluating their mucous membranes, and all kinds of other things to tell us that they are systemically stable or they could potentially be developing complications.
Yeah, one of the problems that we sometimes have, we get called in, is one is diarrhea, right, from a medicine standpoint, and the other thing is we pull in our other services when they have foot problems, and that sort of plays into what you just talked about.
Yeah.
And for me, that's one of the toughest things, is that they get sick and you support them through it, and because of the systemic inflammation, the endotoxemia you've talked about, it hits their hooves. And I mean,
Yes.
that's just a real tough deal.
Yes.
Really
Yes.
tough deal.
Well, one other thing that we haven't touched on is there's some economics in it too,
Oh, yeah.
right?
Absolutely.
And so you have owners who, they might go out on a limb and go, okay, this is how much we can pay for and those are uncomplicated, and then the complications just ramp those bills up a lot because the care goes up so much.
Yeah, but I think one of the most important things you touched on was like really early on, it's a time thing.
Yes.
And as soon as that horse is not responding to reasonable analgesia on the farm within a reasonable time, you just get them on the bus and get them in here because you just don't have the time. And you're saying that this gut is twisted off and its blood supply is gone. I mean, how long can that tissue last? I mean, you have these horses come in. How long can that tissue be traumatized like that and have any chance of it coming back?
Not very long. They essentially have hours. We know that if you wait 4 hours from the onset of symptoms, you have a 13% greater likelihood of death. And then so time is absolutely of the essence. In general, the early studies on this disease gave a prognosis of down to as low as 35% survival to discharge. And our numbers here are significantly better when we took a look at our data. And that is truly because, I mean, our surgeons are fantastic, but it's not necessarily about the skill of the surgeon. It just highlights how important it is to get those horses to surgery as quickly as possible. Our farms are so close, and these farms do such a great job at recognizing this disease and colic in general, and their mares are so well managed that they get them to the hospital quickly. Whereas in these earlier studies, they could be, if you have to trailer a mare with a twisted colon for 4 hours, you're already in significant problems once you get into surgery. Whereas if you can get them here in 20 minutes, you're going to have a much better prognosis. And that shows with our numbers. We have about an 88% survival rate compared to what is generally in the rest of the equine population a pretty deadly disease. And that's all due to the time.
Well, and another factor in that is not just trailering time, but we have night watchmen too, right?
Yes.
So in other parts, and like if one of my horses starts to colic at 11 o'clock at night, it's going to be 6 o'clock in the morning before I find her.
Right.
So a lot of these horses, you just, in other parts of the country, you wake up in the morning and you find them and you have no idea how long they've been going at it.
And then by that time they're extremely sick.
Yeah. And you mentioned heart rate and pack cell volume and that, but, if you're out in the field trying to make a decision what your horses have, I mean, a rectal evaluation, right? So that's going to get done here as well. But what do you gain from that rectal exam? What are you looking for to put you in the ballpark that this horse has a colon torsion?
You can feel a lot of gas distension of the colon on the rectal exam. That's going to be kind of your number one thing. It's going to be really strongly indicative that they either have a displacement or a torsion. They have a significant gas buildup.
Okay. You mentioned about the colon like twisting it. Is there anything characteristic, like it's gas filled, but is anything else characteristic about it? You mentioned about wall thickness and that. Can you feel those things on the rectal?
Yes, you can. You can kind of feel if it's a little bit thick. You can sometimes make out some edema. Yes.
Yeah. And you mentioned gas before in the diet. How do we control that with these horses? Are some just more prone? You mentioned dietary issues. You got any ideas on what people can do to minimize the chance of this? Because it's pretty frightening sounding what you've been talking about.
It is. And these recommendations are very similar to recommending how to prevent any type of colic. So making changes to the diet or to their daily routine gradually is going to be very, very helpful. We know that if you have an increase in stabling in the prior 2 weeks, or sudden changes in diet, all of those tend to predispose horses to developing gas buildup in their intestinal tract. So any kind of changes that you make to a horse's diet, environment, daily routine should be made gradually to allow their system to adjust.
Okay, well, that's pretty...
Good sound advice.
Yeah, good sound advice. Pretty sobering, but yeah, I mean, I think that's really good for anything, like from diarrhea standpoint, right? I mean, just don't make any sudden feed changes. Horses like routine like we do.
Yep.
So after the surgery, You say you have a normal recovery. What's in store for that horse? What limitations they have, and how likely are they to do that again? Are they more predisposed to have the same thing happen again?
Yes, they are, unfortunately. And that's another thing that you kind of need to consider when you're considering the economics of this disease. Horses that twist their colon are definitely more likely to twist it again or displace it again. And the more times they do it, the higher that frequency goes up, if that makes sense. So generally, the first time that a horse will twist their colon, they have maybe about a 15 to 18% chance of it recurring. And so we'll replace the colon, we'll empty all the gas out of their contents, stitch them up, and hopefully they do great. Sometimes they'll twist again. And if that happens, sometimes what we recommend is to do what's called a colopexy, which means essentially we are attaching a segment of the large colon to the body wall to try and prevent it from moving around. Other places will do things like large colon resections, so they'll take out a big chunk of the large colon to kind of keep it from retwisting. So there's a couple of things that you can do to help prevent it from happening again, but there are risks associated with that. So a horse can still twist their colon even if you have attached a little piece to their body wall. They can kind of twist around that or in other places that aren't attached. And a very small percentage of these horses that you've done this procedure to will tear and will rupture their intestinal tract. So because of that risk, it's not going to be a procedure that we recommend on a horse's very first surgery where they've twisted their colon for the very first time. We kind of weigh the maybe 85% chance that they won't do it again against the risk of complications from the prevention, essentially.
Gotcha.
But yes, unfortunately, once they twist, they're likely to do it again.
Okay. So what would be the normal post-operative period? Say, we've talked about a lot of things which can go wrong, but what would be the roadmap for this horse post-surgery, post this abdominal surgery? How long would you need to confine it for? How would you feed it? How would you manage it? And what would be expectation to get it back to a normal functional life?
Yeah. So within the first couple of days, obviously immediately after surgery, we're going to keep them muzzled, give them fluid therapy, supportive therapy, and what other medications that they need, antimicrobials, analgesics, anti-inflammatories. Then hopefully within 3 days, they'll be able to stop their IV antibiotics. They'll be able to eat again. We kind of reintroduce feed gradually, but it is within the first couple of days. And if they're tolerating that well, we can send them home to care on the farm where they do need a little bit of stall rest. They need time for that incision in their ventral abdomen to heal. And then once that has healed with a little bit of stall rest, they can return to normal care.
What are those time frames? A little bit of time for the incision to heal and a little bit of time for convalescence afterwards. What are you going to tell your owners with the horses that you've done surgery on? They need to spell that abdominal incision.
Usually about 3 or 4 weeks of stall rest, and then probably another 4 weeks of small paddock confinement before they can go out and run amok.
Okay. So yeah, you would expect in what sort of time frame? Say I had a trail horse versus a jumping horse. What sort of time frames are you going to give people on getting back to what they were doing?
Depending on if it's an athlete or not, I would probably give them at least several months.
Yeah.
Before returning back to function.
Okay. And you'd expect in that time the body will be healed up and it'll be just as strong as it was before.
Well, no, it never is as strong as it was before.
Okay.
And it takes quite a bit of time for it to regain some strength. But you can return them to function and start to build up the abdominal muscles too, which helps strengthen the closure.
Okay.
So this is another group of those horses, though, that the advances in veterinary medicine have saved horses now that we weren't saving, a few decades back, not that long ago. And we talked to Dr. Hubble about that. Part of that was anesthesia, right? The advance of anesthesia. What else has helped us with colic surgeries in general? And do you see anything else coming down the line that maybe some advances that we have coming that can make them even better?
Well, I think that probably the most important thing that has helped us as surgeons is the quality of the referral care. And again, that just goes back to the time. So we are very lucky here. We have fantastic farm managers. We have fantastic field veterinarians who can go out and readily diagnose these things and get them here as quickly as possible. Essentially, time is the essence. And so I think that the best thing that we can do for these horses is just be able to recognize when a horse is having abdominal discomfort, recognize it quickly, and be able to treat it and refer it if necessary, and get it to surgery if necessary.
Good. Well, I think that's going to cause a lot of people to look a lot more closely at their horses and be a little bit more proactive when they're having a little bit of a roll in the paddock.
Yeah.
Yeah, it's a fear that all horse owners have, right?
Mm-hmm.
Yeah.
And definitely not something to be taken lightly.
Yeah, absolutely. Well, this has been great. We thank you for your time and your expertise.
Yeah, thank you very much. It's been enlightening, and appreciate your time.
Absolutely. Thank you for having me.
Great. And that was Stallside. You've been listening to Dr. Sarah Templeton talking about colon volvulus. See you next time.
Why the podcast? Rood and Riddle Veterinary Pharmacy has a relatively small marketing budget, especially when you compare us with our competitors. I understand that marketing is important, but telling people that you exist and what you do and why your products or services are different is a must. I thought about what makes us unique, and I realized I wanted to give people something of real value. That's how the podcast idea evolved. I wanted to use the money we had set aside for marketing, not to tell people who we are, but rather to show them, to open up how we do things and give something of value at the same time. The content of this podcast is designed to do exactly that. It's not going to serve as a shameless plug for pharmacy products or services. We want you to know who we are, that quality is uncompromised, that we care about people and their animals. If there are specific topics that you would like us to cover or guests that you would like to hear from, please email us at stallside@rrvp.com. Hope you enjoy the show. Just one more note, nothing that we talk about here today should be construed as veterinary advice. That's why you have a relationship with your own veterinarian. Thank you for listening.